So there are many definitions are there for seizure. These are one of these is a sudden brief disruption of the normal functioning of neuron in the brain. Another is it is asynchronous rapid firing of impulses from the group of neuron. हाँ क्लास सुरू आहे बेटा माझा. हां थोडा 2 ते 3, 3 ते 4, 4 ते 5 मध्ये फक्त ब्रेक आता सुरू केलेला आहे. मग एक काम कर ना तू 3च्या आसपास आहे म्हणजे तो मधल्या काळामध्ये आपण करू एक्झॅक्ट 3ला इथे. So these are various definitions, and on that basis we can have these drugs and various classes related to. So it is a sudden, so all of a sudden it happens. Then asynchronous, normally our neuronal system has got a synchrony, one after another. It is not desynchronous, so it is asynchronous, rapid firing. So these are various definitions which define seizures. Basically what we understand from that, it is the abnormal impulse generation and passing through group of neurons, and these are affecting overall normal functioning of CNS. This is what the meaning from the seizure is. Now it may appear as a sudden cry and fall. All of a sudden the person will start crying without any reason and fall down. It may be followed by convulsive movements of all convulsive movement. Therefore we call it as a, what is convulsive movement? All of a sudden hands, the limbs are contracting and getting relaxed. We call it as a tonic and clonic situation. Tonic means they are contracting, clonic means they are relaxing beyond the normal tone. You know now, you have seen the drugs acting on muscles, so we know what is tone. So anything which increases tone, we will call it as a tonic. Those which is opposite to that, decreasing the tone, we will call it as a clonic. Then it may cause shallow and interrupted breathing, because this is all happening to muscle and respiratory muscles, that is diaphragm is also a skeletal muscle, and therefore it can affect breathing because too much contraction or too much relaxation of diaphragm. If you remember our skeletal muscle system, we have seen that what are the problems. So whenever the respiratory muscles are affected, it affects respiration. Because of that, there is a cyanosis, that is blue coloration of body. It can cause loss of bowel, bladder control, because muscles are contracting, even smooth muscles are contracting not properly, and there is a loss of control on that. There is a slow return to the consciousness. Post-seizure confusion and or fatigue can be, because why fatigue? Because too much energy is required. This all features which just now I described, they are called as a generalized tonic, clonic, or earlier long back it was called as a grand mal seizure. Okay, so these are the types of seizure simultaneously we are discussing. So this is what why you are joining. Many people are joining too late. When we start at 2 o'clock, when I open the link at 2 o'clock, many are joining. Even despite of all these delays, only 11 students are so far joined. That means you people are not interested. I have already informed long back, much ahead of the time, but it means that students are not that serious. I have already many times I have done that. I have not taken the persons in, but I do not feel this is a good thing. Hence I have taken these people in today, at least to inform that this should not happen, because it causes disruption in my lecture flow, and therefore please see that you all are in time. So this is all about general tonic, clonic or grand mal seizure. Then another type, it may be having a blank staring, just like staring, many times people do it, or fortunately classrooms are not there, but they are just staring at the teacher like that, without any understanding like thing. And this blank staring means without any kind of exchange of communication, exchange of ideas or exchange of knowledge. This is just staring going on. okay. Then chewing like action means although nothing is there in the mouth, but something they are chewing. Other repetitive purposeless movements are doing. These are all type of seizure also. Then wandering, confusion, incoherent speech, speech is not appropriate, speech is not having relevant words. All of a sudden crying, screaming, running, then flailing, sudden loss of muscle tone and fall, picking at cloth, disrobing. These are all sudden activities are there. So this is also another type of seizure that is called as a partial seizure, and it is known as a complex partial seizure because too many situations are arising into it. We shall see all the classification later what seizure is, but we are just describing various things related to seizure. Then we will go for more details about classification. Then what seizure causes? High fever can cause seizure, particularly in infants. Some drugs like alcohol withdrawal can cause seizure. Near drowning or lack of oxygen, it can cause seizure. Metabolic disturbances, lack of sufficient energy can cause it. Head trauma, that is injury to head, brain tumor, infection, stroke, complication of diabetes or pregnancy, these all can cause seizures. And the common cause of seizure is epilepsy. So epilepsy and seizure are that way related to each other. Epilepsy is also known as a seizure disorder, and it is a chronic neurological disorder characterized by recurring seizures that are not otherwise provoked by acute injury or health emergency. So epilepsy is a disease in which the seizures are often coming. We have seen what seizure is. In epilepsy, epilepsy and convulsion is synonymous. So in that, during that, whatsoever epilepsies, whatsoever seizures are there, they are coming repeatedly. So this type of thing is known as epilepsy. So what is epilepsy? It is a common chronic neurological disorder characterized by unprovoked seizure. Unprovoked means we have seen some of the reasons. Example, we have seen alcohol withdrawal, we have seen some of the drugs causing, we have seen the injury to brain is causing it. These are provoked, okay, these are, they have some primary cause. But if there is no primary cause, then we call it as an unprovoked seizure, and these unprovoked seizures, they are epilepsy. Seizure is caused by sudden burst of excessive electrical activity in the brain. Just now we have seen what it is, causing temporary disruption to the way of normal brain work. It results into brain's messages becoming halted or mix up, or rather just like a cross connection it is there, or just like if you have seen the fuse goes off, like electrical fuse you might have seen when two different current are mixed. So when these currents which are normally flowing in a proper way one after another, and they are mixed, all of a sudden they are occurring, then it is resulting into epilepsy. So what kind of experience the person will have during seizure will depend on in what portion of the brain this epileptical activity is there and how rapidly it spread. On that basis, the person will give various symptoms. But this tonic, clonic and crying and all, we have just now seen, these are various symptoms. Now there are many different types of seizure, around 40 types of the seizures are there, and they are unique to the given individual. It affects in UK, what's population is there around 1,12,000 young people under 25 years, and the children as having more chances than that of adult. It can affect anyone at any time. It is not contagious, is very important, because it is not because of any infection that from one person to other person it will cause. It is not like that, or just like what's a COVID situation we say. So we are having it contagious, and therefore we are wearing mask, etc., and trying to keep away from the people. So it is not like that. It is not contagious. There is no connection between epilepsy and intelligence. There are many people, or there are many known scientists, they were having epilepsy problems and they were intelligent. So intelligence and epilepsy has no that way relations. However, very important thing is after epilepsy attack, the brain functioning reduces, and that makes a problem. When it is a normal one, it can function like, and those which are having very recurrent attacks of epilepsy, their functioning definitely reduces, because it puts good load or good burden on the brain to function. Approximately 75% of the children either outgrow their epilepsy, or that is, while growth the epilepsy goes down, or their epilepsy can be controlled with medication without any big problem. Now, what are the causes for the epilepsy? There is no identified cause. I told you alcohol was an identified cause, trauma was the cause. So there are various reasons why there is epilepsy, and in 6 out of 10 cases there is no identifiable cause. Those which epilepsy which known cause, they are called as a symptomatic epilepsy. There are two main categories: those which are caused by brain injury or diseases like infection, brain tumors, trauma. So these are secondary to something, malformation or degeneration, metabolic disorders, etc. In some cases there are hereditary factors. Epilepsy can be inherited, but in most people there is no family history of epilepsy. Genetic testing can help to identify the specific gene defects, which may be useful for the treatment, prognosis, and the genetic counseling. So these are the, what are the etiological, we call it as a etiological factors. So what are etiological factors? So these are not known, but main important are there: hypoxia, tumors, then decrease in the nutrients or energy production like glucose, etc. They are main causes which are making impact on that. So we have got two important classification. One we call it as a partial epilepsy or partial seizures, another we call it as a generalized seizure. Again, we have got subtypes in partial, that is simple partial. Simple partial means the patient is alert and active during that. Complex activity with change in the awareness, that will cause the, although it is not causing any unconsciousness or anything, but there will be changes in the awareness. Secondary generalized, that is activity begins in the one area and that spreads. Now what partial is, suppose that is happening in one area, then that will remain to that particular area, that will not go beyond that area. Therefore we call it as a partial. Or if it is remaining in one hemisphere, then it will remain on that hemisphere only, so we will call it as a partial. Generalized means it will cross it and it will go to other hemisphere also, and it will be spreading into various parts or various organs of the brain, or we know that various areas of the brain rather. So partial is simple, partial can be simple, partial can be complex, partial can be secondary generalized. Then we have got another feature, that is generalized one. In generalized, the simplest form is just staring or blinking, no activities. Okay, so even many may not realize that they have got seizures, but then it can grow into further complication. But this simple staring and blinking, this can be the seizure, we call it as absence seizure. Then myoclonic, that is brief jerking movements, usually of upper body, that is called as a myoclonic seizures. Tonic-clonic, that is going steep and falling, followed by convulsions, jerking movement. So why there are jerks? I told you, body contracts, relax, contract, relax. This causes jerk movement. So this is called as a tonic-clonic seizures. Tonic means going steep only, failing, but without any convulsions, without any relaxation of that. What is convulsions in that? The convulsions are jerking movements. Why jerk movement are there? Because tonics are contraction, then after that there are relaxations, so from tonic to clonic. So this type of movement that gives jerks. So in tonic there are no convulsions or no clonic activities are there, only stiffness is there, and because of that person will fall. Atonic, falling limply onto the ground. This is called as atonic. We shall see more details also later. What are the primary treatment options for this? So you can go for anti-epileptic drugs. Then there are certain surgery if that part is responsible for that, and that is becoming just like, if you remember this cardiac, this one arrhythmias. This is sort of arrhythmia in brain. If you can just remember what arrhythmia is, and we have seen that there are various focus are there. If you remember, we have seen some therapy, we call it as ablation therapy in arrhythmias. Here also such ablation or that particular portion which is causing more firing of the neuron, that is removed, that is the surgery treatment. What are the secondary treatment options? Vagal nerve stimulation. Why vagal nerve stimulation? Vagal is that is releasing acetylcholine and it causes inhibitory action at many places. Then another is ketogenic diet, that will cause increase in the ketogenic concentration, and that will be somehow reducing the episodes of seizures. Psychological, we can inform the patient that what kind of symptoms he is feeling before actual seizures are there. We in migraine headache, we call it as aura. Aura means just before that particular problem, what kind of feeling the person will be developed, and then person can get trained with that. Now that he is going to get the attack of that epilepsy, that is called as a that is understood like that. Then complementary therapy, any other treatment like food supplements, etc., can be given to the people. So these are various primary treatment options. Now those which are on medication, what can be the factors which can trigger the seizures? So first one is missed medication, that is whatsoever medication is there, if it is not taken in time, it can cause illness. Infections like urinary tract, respiratory tract infection, lack of sleep can cause it. Stress, like including stress which is caused by constipation or pain. Heat, boredom, alcohol, photosensitivity, and missing meals. These are various factors which can trigger seizures. Means trigger, again I'll explain you what it is. Trigger means the person is having chances, person was diagnosed with that, and the person was given some treatment. Now why it can be there? What is the boredom? Getting bored, too much bored. That is called as a boredom. Okay. किसी में इंटरेस्ट ही नहीं आ रहा है, दैट इज अ बोर्डम, बहुत बोर हो रहा है, ऐसा बोलते हैं ना. सो दैट इज व्हाट बोर्डम इज. So when we say that we are bored, then at that time also our mental activities are going on. Mind is thinking about it, and mind feels that the person is getting bored. Why a person is getting bored? Because no activity wherein the person can have interest, that is going on. And therefore patient is thinking, or the person is thinking too much, which may cause triggering some of the neurons, and they can start impulses, firing impulses, and this can be again asynchronous as we have defined in seizure. Now what we can do when there is a seizure? अगर किसी को seizure हो जाएगा, what can be done? So one thing is for sure that one cannot stop seizure once it starts. उसके पहले हम suppress कर सकते हैं. एक बार आ गई तो we cannot do it. Protect the person from any real or potential danger. Now we know that what happens during seizure. We have seen that because of seizure, two very dangerous thing which happen is person falls down. So when we know that person is prone for seizure, when it is diagnosed, then very important thing is he should be guided in such a way that wherever the person is there should sit in or should be remaining in such areas where the falling will not impact. If it is a very hard surface and then person falls down, then it can cause this trauma, we call it as a, that is injury to the brain or important body parts, and that can be dangerous one. So this is a potential danger, and real danger is we have seen that it affects the respiration. So if that respiration is affected, then person will go into hypoxia. This hypoxia can cause more damage to various organs, including brain, and it can also trigger more and more seizures also. So it can become a cyclic one, which can be very dangerous. If injured now, the patient has fallen down, then go for the first aid to the patient. There is no single test that will person can say that there is epilepsy is there or not. Because staring, we might have seen people have, many have a habit to have the staring or like that, or they can fall down for one or other reason. There can be many reasons why the person is falling down. So we do not know exactly on the symptomatic base. It can be very difficult to exactly diagnose what can be there. But it can be based on the medical history and eyewitness who have seen, who can tell that what can be there. EEG, MRI, blood and genetic testing can be there, then can be made, and it can help to identify the type of epilepsy and possible causes. Because if it is hereditary, then one can go for MRI, will show that if there is any problem in the anatomical structure of the brain, कहीं पे ट्यूमर है क्या है या कहीं पे गठान है क्या, whatsoever it may be. So that can be seen into it. Is there any damage to some of the portion? So this can be seen, and accordingly MRI will be there. Blood and genetic, blood will give you whether there is hypoglycemia, hypoxia, etc. And genetic means if somebody relative is there which is having that can be understood. Already we have seen it is not contagious, it is not a mental illness, or it is not a cognitive disability. Very, very important thing. It is not contagious. Just like we are having fear of COVID or something, keeping away from the people. So it is not like that. It is not contagious. If the person is is known to have epilepsy, and if it is whatsoever close the person may be, no nearby person will be affected. So it is not contagious. It is not mental illness like schizophrenia or depression, etc. because the mind functioning is completely normal. There is no cognitive disability. Cognitive disability means learning is not a problem. Intellectually the person is very fine. Rather, as I told you, many scientists, they are intellectually very good and they had this epilepsy. So there is no problem. It is just neurological dysfunction that can begin at the birth, childhood, adolescence, or even during adulthood. It can be there, and this is because of the rapid firing. But very important thing is, yes, if this remain untreated for a long time, it can affect the person. Still it will not be contagious, but it can be it can convert it into mental illness. The patient can get depressed, or patient can get into anxiety like mental diseases, or it can also cause cognitive problem or cognitive disability if it is not treated for a long period of time. So what are the causes of epilepsy? We have seen this. It can be stroke, it can be brain tumor, it can be brain infection, it can be head injury, it can be metabolic problems like neurological conditions, genetic factors. These are there, we can check. It can also occur in the patients already are having diseases like or problems like cerebral palsy, cognitive impairments, then attention deficit hyperactivity syndrome, we call it as ADHD, attention deficient diseases, developmental disabilities means the brain is not properly developed, autism. So this is also a genetic disease which is having lesser brain activities. So these are various diseases which has caused this. But majority of people who have epilepsy do not have other impairments, most of the people, and they live their life normally, and particularly those who get the treatment in time and continue with the treatment, they can be very well and normal one in the life. In generalized seizure, the electrical disruption that involves the entire brain, and therefore we call it as a generalized, both hemispheres, if you remember just now I told. So we are making more elaboration about various seizures. So in generalized, what is the major one is called as a tonic-clonic seizure. It is also called as a grand mal seizure. It can cause loss of consciousness. Because of that, there can be fall, stiffening of the body, followed by rhythmic shaking. Why there is a rhythmic shaking? Tonic and clonic. So tone is there, which causes contraction. Body comes closer towards the center once the person, to the main trunk body rather we can say. So all the limbs come closer to that. There is a shrinking of body, and then there is a relaxation. So this contraction and relaxation, that is causes a rhythmic shaking of the body. Breathing may stop temporarily because, as I told you, all the skeletal muscle will be contracted or too much relaxed, and therefore that normal physiological ventilation will not be taking place. Skin, nails, lips may turn blue. We call it as a cyanosis. Loss of bladder, bowel control may occur because the skeletal muscle will lose their control. It lasts to around 1 to 3 minutes. More it lasts, more is the damage to the body. It will followed by confusion and sleepiness. Why confusion and sleepiness? Because a whole neuronal machinery has acted more. The more action was taken during that period. So it is giving as a fatigue, like बहुत सारा काम करने के बाद, or those who have read too much, or if it is a hard paper, then when there is too much neuronal activity. So this type of activities can be there, it can be seen. In partial seizure, the electrical disruption involves limited area of the brain, I told you. So it is not complete area, it can be only one hemisphere, or it will be depending only one of the important area, functional areas. So simple partial seizure, this seizure activity is in the brain that causing rhythmic movements, isolated twitching of the arms, face, legs. So only one portion like that, and there can be just twitch are there. Sensory symptoms like tingling, weakness, sound, smells, taste, feeling of upset stomach, visual disturbances. So this type of sensory symptom can be there. That is, some tingling sensation is there, feeling weakness is there, hearing some sounds, then smells, taste. So this type of sensory symptoms are there. Then psychic symptom, deja vu. Deja vu is a what we can say Latin word, and that shows that sense of too much fear. That person is almost thinking that now there is no escape from the situation. A very dangerous situation is coming, this kind, and now cannot escape. So what feeling goes, that is called as a deja vu. Hallucinations. Hallucination means the person gets daydreaming like thing, rather, okay? Thinking that some can see something which is not existing, can see that some poster is talking to him, or some god is talking to him, some person who has died is talking to him, some like that. So this is what, and these are various kind of hallucination. Visual means can see the person there, can have almost means it is not the person is not there. Example, God is not there, but can see that God is standing in front of him and giving some information to the person, is called as hallucination. So it can be, hallucination can be visual, that means can see something, auditory, that means can hear something, okay. It can be other sensory, like taste, that something, somebody has given some sweet thing and now the mouth has become sweet or sour or like that. So all kind of these are there. It can be all special senses, can be somebody is touching, somebody is slapping, like that. So these are all hallucination person can have. These are not true, it will be just feeling. Feeling of fear or anxiety can be there. So these are various psychic symptoms. Usually it lasts less than a minute. It may, if it is not controlled or if it is not taken care of, then it can be precede generalized seizure, and this simple partial seizure can get converted into generalized, means whole body it will be there. Complex is characterized by altered awareness. It can cause confusion, it causes inability to respond. It is automatic purposeless behavior like picking at a cloth, chewing or mumbling type of activity, emotional outburst, all of a sudden crying, as we have seen this, all of a sudden laughing. So these are various emotional outbursts person can have. It may be confused with the drunkenness or the drug use. It can be having a visible belligerence, that is this aggressiveness like activity. It seems like that. It is not like that. Belligerence is also a sort of aggressiveness. So these are various complex partial seizures. Now there are various anti-epileptical drugs which can be using, and we shall be seeing this in our next class. I'll just make the list of this. So this is valproic acid, felvamate, tiagabine, then levetiracetam, lamotrigine, phenytoin. These were the oldest one: phenytoin, phenobarbital, then gabapentin, carbamazepine, oxcarbazepine, topiramate, zonisamate, pregabalin. These are all the drugs. Now I'll suggest you to read the physiology of nervous system. It is given. In physiology, you can read various neurotransmitters which are present. Please read how various neurotransmitters are working, what are their roles. I'll just give you some hints, like there are some excitatory neurotransmitters, there are some inhibitory neurotransmitters. So the excitatory neurotransmitter will cause excitatory reactions, or they causes excitatory postsynaptic potential, while there are inhibitory neurotransmitters, they will cause inhibitory postsynaptic potential. These all terms you have seen it earlier also, you have seen it, what is EPSP, what is IPSP. Please write this in group, because only 8-9 students are there in class. You inform everybody that this is the homework and I like to check it tomorrow. By tomorrow I need to have the information what is IPSP, what is EPSP, what are various kind of neurotransmitters, what are the excitatory neurotransmitter, what are the inhibitory neurotransmitter, through which receptor they are working. Okay, what are the receptor through which they are working? This is very, very important. Okay, you can have certain drugs which can have different kind of receptors. Like acetylcholine can be excitatory at some places, it can be inhibitory at some places. Similarly, dopamine can be excitatory at some places, it can be inhibitory at some places. So we should be aware about this, what are the excitatory and what are the inhibitory neurotransmitters. Go through it, write it in the group. Today this homework has been given and tomorrow sir will be asking. This will help people to understand what are these neurotransmitters and where the drugs are going to act. How, because once we understand this physiology, then you will be understanding what is the pharmacology of various drugs. So go through this, read this, and if you have any difficulty, you can ask me. Okay, but please go through the details about various physiological aspects, or yes, about what are various physiological aspects in the CNS. Check the functioning of CNS. Those who are interested, after reading through various physiology book like Totor or Guyton, they can read in Goodman and Gilman. Whole chapter is mentioned for various receptors and various drugs, various CNS agents. So go through it and just check it. So tomorrow I'll ask you questions on these various neurotransmitters and where they are functioning. Before that, I am expecting you people are writing something on our WhatsApp group about this, about homework. Whatever you will do, you can put it, you post thing, you attach your files in any format, you can write it and you put it there. So take care and be safe.